Hi everyone, welcome to AceAnatomy. I'm Dr. Divya DSa. Today we are diving into the heart of the matter, literally. Get ready to explore coronary circulation, the incredible network of vessels that keeps our heart fueled and pumping strong 24/7. Stick around because by the end of the video, you will know exactly how our heart keeps itself alive while working non-stop for us. Hit the subscribe, ring the bell and jump right in. In this video, you are going to learn about coronary circulation, about right and left coronary arteries, coronary predominance, venous drainage, and about coronary sinus. Coronary circulation is about the arterial supply and venous drainage of the heart. The arterial supply is mainly by the right and left coronary arteries, and the venous drainage is mainly by the coronary sinus. The heart is mainly supplied by two coronary arteries, that is the right coronary and the left coronary artery. Only the inner 75 to 100 micrometers of the endothelial surface of the heart, it gets nutrition directly from the blood in the cardiac chambers. So anatomically, these coronary arteries, they are not end arteries because they anastomose with each other by their trunks, branches and sub-branches, mostly at the precapillary level. Functionally, however, they behave like end arteries, and that is because most of the anastomosis remain impervious, and they are vasa vasorum of the ascending aorta because the heart is developed from the fusion of the two primitive endothelial tubes which represent the ventral aorta. Before we begin with the coronary arteries, let's understand the site of origin of coronary arteries known as aortic sinuses. So the aortic annulus is guarded by three cusps, three semilunar cusps. So one is in front, that is the anterior one, and two behind, they are the two posterior ones. So above each of these cusps, the ascending aorta presents a dilatation, and these dilatations are known as the aortic sinuses of Valsalva. The anterior aortic sinus, it provides origin to the right coronary artery, and the left posterior aortic sinus, it gives origin to the left coronary artery. So these two sinuses, that is the anterior and the left posterior, they are known as the coronary sinuses. Whereas the right posterior aortic sinus does not give origin to any coronary arteries. So that is why it is designated as non-coronary sinus. The origin of the coronary arteries can be observed by taking a section at the root of the vessels. So here we can see the three aortic sinuses, the anterior, the right and the left posterior. So from the anterior aortic sinus, we have the origin of right coronary artery, and from the left posterior, we have the origin of left coronary artery. The right posterior aortic sinus doesn't give origin to any arteries. So that is why the anterior, it is known as the right coronary cusp, the left posterior is known as the left coronary cusp, whereas the right posterior is known as non-coronary cusp. So thus the coronary arteries originate from the anterior and left posterior aortic sinuses. Coming to the course of the coronary arteries, the right coronary artery, after it arises from the anterior aortic sinus of the ascending aorta, passes forwards and to the right between the pulmonary trunk and the right auricle. It passes downwards along the right part of the atrioventricular groove. It winds around the inferior margin of the heart and passes upwards and to the left along the posterior part of the atrioventricular groove, and it reaches the crusk of the heart. The crusk of the heart is the meeting point of interatrial, posterior intraventricular and posterior atrioventricular groove. So here it ends by anastomosing with the left circumflex artery, that is the branch from the left coronary artery. Now the left coronary artery, it arises from the left posterior aortic sinus. So it passes behind the pulmonary trunk and then appears forwards and to the left between the pulmonary trunk and the left auricle. So here it ends. It has a very short course and it ends by dividing into the left anterior descending or anterior intraventricular artery and the left circumflex artery. The anterior intraventricular artery, it is the continuation of this left coronary and it descends in the anterior intraventricular groove. So it winds around here, that is the incisura apicis cordis, and it ends on the inferior surface by anastomosing with the posterior intraventricular branch of the right coronary artery. It is also known as the posterior descending artery. So this anastomosis usually takes place at the junction of the anterior 1/3 and posterior 2/3 of the posterior intraventricular groove. The circumflex artery now, it passes here at first along the left part of the atrioventricular groove, winds around the left border of the heart, and it occupies the posterior part of the atrioventricular groove. And here it anastomoses with the right coronary artery, usually on the left side of the crest of the heart. Let's now look at some of the variations in the termination of right coronary artery. In about 60% of the subjects, it ends at the crest of the heart where it anastomoses with the circumflex coronary artery. In about 10%, it terminates at the inferior border of the heart. In another 10%, we see it terminating midway between the inferior margin and the crest of the heart. And in about 20%, it ends in the traverses the posterior intraventricular groove and it ends there. Now let's study the branches of right coronary artery. So for the purpose of description, the branches are divided into two groups. Those arising from the first segment, that is from the origin up to the inferior border, and those arising from the second segment, that is from the inferior border up to the crest. So among the first segment branches, we have atrial branches. So atrial branches, they are arranged in three groups, that is the anterior, lateral and posterior groups supplying the corresponding sides. And they also supply the myocardium of the right atrium. Among the atrial branch, an important branch is the sinoatrial nodal artery. So in about 65% cases, it comes from the initial segment of right coronary artery itself. And in about 35%, it can arise from the circumflex branch of left coronary artery. The ventricular branches, we have two important named ones. One is the conus artery, that is the right conus artery. Usually it is the first branch of the right coronary artery, and it supplies the infundibulum of the right ventricle. Sometimes this right conus artery can directly arise from the anterior aortic sinus, and then it is known as the third coronary artery. Then among the ventricular branches, one of the prominent branch is the right marginal artery. It is the longest ventricular ramus and it follows the inferior border of the heart towards the apex and supplies the adjoining surface of the right ventricle. So it is the right marginal artery. Next, branches coming from the second segment, we have the atrial branches which supply the posterior surface of both the right and left atrium. Among the ventricular branches, they supply basically the from the trunk of, that is the branches which arise from the trunk of the right coronary in the posterior part of the atrioventricular groove. They will supply the diaphragmatic surface of the right ventricle. And then we have the posterior intraventricular branch. So it arises from the right coronary artery near the crest of the heart. So in 70% of the subjects, we see it arising from the right coronary. Okay, and rest we might see it arising from the left circumflex artery. So this passes along the posterior intraventricular groove here. Okay, and it passes close to the apex, where it will anastomose with the anterior intraventricular branch of left coronary artery. So on the basis of the continuity of this posterior intraventricular branch, either from right or left, we have the right coronary predominance or left coronary predominance. So this posterior intraventricular artery, it also provides branches to the diaphragmatic surface of the right and left ventricles. One of the important branch of this posterior intraventricular artery is the septal branch. So the septal branch, it supplies the posterior inferior 1/3 of the ventricular septum. And one of the first septal ramus of the posterior intraventricular artery, it will undergo an inverted loop and it will supply the AV node. So in about 80 to 90%, the AV nodal artery is derived from this right coronary, whereas in 10 to 20% it can come from the left coronary artery. So here now we will see the right coronary artery in the specimen. So here we have the right coronary artery beginning from the anterior aortic sinus. So this is the pulmonary trunk, this is the right auricle. So here it is running in the right part of the atrioventricular groove. So this is the first segment of the right coronary, and here we have the second segment. So here it runs in the posterior part of the atrioventricular groove, ends at the crest. Okay, and this is the terminal branch it gives, that is the posterior intraventricular artery. So in the first segment we are able to see the coronal artery. Here the atrial branches are going a little deeper here. These are all the ventricular branches, and this is the inferior margin. It's also called as acute marginal artery. So this is the largest of the ventricular rami. And here on the posterior part we can see the atrial branches and the ventricular branches, and the prominent one here is the posterior intraventricular artery. Here we can see the annulus of Wilson's, which is an anastomotic necklace which is formed by the anastomosis of the right conus artery, which is from the right coronary, and the left conus artery, which comes from the left anterior descending or anterior intraventricular artery. And this anastomosis is formed around the infundibulum of the right ventricle. Now let's study the branches of left coronary artery. The left coronary artery gives two branches, that is the anterior intraventricular artery, another one is the left circumflex artery. The anterior intraventricular artery passes in the anterior intraventricular groove, where it gives the ventricular ramus for both the right side, that is the right ventricle, as well as to the left ventricle. So among these ventricular branches given on the right side, a prominent one is the left conus artery. Left conus artery supplies the infundibulum of the right ventricle, and it anastomoses with the right conus artery. Among the ventricular rami on the left side, the prominent one is the diagonal artery. This anterior intraventricular artery also gives septal branches which supply the anterior superior 2/3 of the ventricular septum. The next branch is the left circumflex artery. The left circumflex artery gives atrial branches. Among the atrial branches, one important anastomotic branch is the Kugel's artery, which anastomoses with a similar branch from the right coronary. And among the ventricular branches, we have the posterior intraventricular artery, and this is usually in about 10 to 20% of the individuals. The posterior intraventricular artery extends as a continuation of the circumflex branch. So it also gives the septal branch, and the septal branch supplies the posterior inferior 1/3 of the ventricular septum. The next branch is the sinoatrial nodal artery. So this arises from the circumflex in about 35% of the subjects. Then the next branch is the left marginal artery. So this left marginal artery is a prominent branch which follows the left border of the heart towards the apex. So to remember the branches of the ventricular branches of left circumflex artery, you can remember the mnemonics slab. So S is for the sinoatrial nodal artery, L is for left marginal artery, A is for the atrial branch, and P is the posterior intraventricular artery. So in the specimen here, we can appreciate some of the branches of left coronary artery. So here we see the anterior intraventricular artery. So it gives ventral rami on both the right side and the left side. So among the left side we can see this diagonal artery which is very prominent, and left marginal artery will be on the left border of the heart. Posteriorly we can see the termination of the left circumflex artery here. So here it hasn't given the posterior intraventricular, so we are not able to see it. An atrial branch of circumflex artery communicates with a similar branch of the right coronary artery along the anterior atrial wall. So this anastomosis, we call it as the Kugel's artery. The coronary predominance is based on from where the posterior intraventricular artery is derived from. So majority of the population, they possess right coronary predominance, where the posterior intraventricular artery is derived from the right coronary artery. A minority of population has left coronary predominance, where the posterior intraventricular artery is a continuation of this left circumflex artery. And on rare occasions, the posterior intraventricular branches are derived from both the coronaries, okay, that is from the right as well as from the left circumflex here. So these individuals, they have the balanced type of coronary distribution. Now let's understand the myocardial circulation, which takes place by anastomosis. So first is the interarterial anastomosis. Here the anastomosis exists between the branches of the coronary arteries. 85% of the anastomosis takes place at the precapillary level and 15% at the capillary level. So the common sites of interarterial anastomosis are annulus of Wilson's, intraventricular septum, and Kugel's arteries. Then we have arteriovenous anastomosis. So these help to supply the nutrition of the myocardium if any minute branch of the artery is obstructed. So this is usually by a backflow from the regurgitant blood of the coronary sinus. Then there is arteriosinusoidal anastomosis. So here the branches of the coronary arteries, they break up into number of myocardial sinusoids. Then there is sinusoidal. So from the myocardial sinusoids, most of the veins, they drain into the coronary sinus. And in sinoluminal, the sinusoids, they drain directly into the lumen of the heart through the venae cordis. Then we have arterioluminal. So here the branches of the coronary artery, they directly open into the lumen of the heart. And luminosinusoidal. So here the blood from the lumen of the heart, it irrigates the myocardium through the venae cordis and through the foramina minimum. So this system is actually vestigial in man. There is also collateral circulation, where there is potential communication exists between the branches of the coronary arteries and the branches of internal thoracic artery and descending aorta. coming to the venous drainage of the heart, about 60% of the venous blood of the heart drains into the right atrium via the coronary sinus. And about 40% of the blood drains into different chambers of the heart via venae cordis minimi, or also known as the Bayesian veins, and the anterior cardiac veins. Now these anterior cardiac veins and venae cordis minimi, they do not open into the coronary sinus. So these anterior cardiac veins, they are about 3 to 4 in number, and they drain the infundibulum of the right ventricle, and they end directly into the right atrium through the foramina minimarum. The venae cordis minimi, they open into the different chambers of the heart through the foramina minimarum. Sometimes the right marginal vein, instead of joining the small cardiac vein, it opens directly into the right atrium. Let's now understand the coronary sinus. So this coronary sinus is a wide venous channel, and it is about 2 to 3 cm long, situated in the posterior part of the atrioventricular groove. So it begins in the left part of this atrioventricular groove, where it receives this great cardiac vein, and then passes downwards and to the right along the posterior part of the atrioventricular groove. So here it is accompanied by the anastomosis between the right and left coronary arteries. So this sinus, it ends in the sinus venerum, that is the posterior wall of the right atrium, between the opening of the inferior vena cava and the right atrioventricular orifice. So if you see here in this specimen, this is the atrioventricular orifice, this is the sinus venerum. So here we are seeing the opening of the inferior vena cava, and this is the opening of the coronary sinus, where it is guarded by a incomplete semilunar valve. This is known as the Bayesian valve. And in this specimen, we can see the coronary sinus here. This is the left atrium, this portion here, and this is the coronary sinus. Now let's look at the tributaries of coronary sinus. We have the great cardiac vein, the oblique vein of the left atrium, the posterior vein of the left ventricle, the middle cardiac vein, and the small cardiac vein. Now all of these tributaries, they are provided with valves except for oblique vein of the left atrium, because this doesn't drain against gravity. So the great cardiac vein here, it begins from the apex of the heart, passes upwards along the anterior intraventricular groove, and it joins with the coronary sinus after winding around the left border of the heart. So here it will receive the left marginal vein close to the termination, or close to its termination with the near the coronary sinus. Then we have the middle cardiac vein here. So it passes from the apex along the posterior intraventricular groove and terminates close to the right end of the sinus, coronary sinus. Then there is small cardiac vein here. It is situated in the atrioventricular groove between the right atrium and the right ventricle and opens into the right end of the sinus. So this usually receives the right marginal vein. Then this is the posterior vein of the left ventricle. So it drains the inferior surface of the left ventricle and ends in the sinus on the left of the middle cardiac vein. This is middle cardiac, so this is the posterior vein of the left ventricle. Then here, this is the oblique vein of left atrium. So this is a very small vein which drains the posterior surface of the left atrium and joins close to the left end of the sinus. So developmentally, it is the remnant of the left duct of Cuvier. So these are the tributaries of the coronary sinus. And that's a wrap on coronary circulation. In my next video, I will give you more insights on the clinical anatomy of coronary circulation. If you found this video helpful, don't forget to give it a thumbs up and share it with your friends. Hit the subscribe to stay connected with AceAnatomy and ring the bell so that you are the first one to know when I decode another fascinating topic. Keep learning, stay curious, and never stop exploring the wonders of anatomy. Until next time.